Greetings, Rhode Islanders and constituents of the deaf and hard of hearing community. The following information is for travel restriction in terms of what's required here in the state of Rhode Island. Anyone who is traveling in Rhode Island or abroad within the United States, all 50 states, including Alaska and Hawaii. So as of now, the Rhode Island Department of Health, their guidelines basically state that whether you are vaccinated or not vaccinated, is that you do not need to have a test before you fly out. Where previously, during the pandemic, we did. You no longer have to self-quarantine before flying out as well. However, the Rhode Island Department of Health does encourage all to follow the CDC guidelines that is listed on their website for those who are vaccinated. They have a set of rules for those, and they also have a set of rules for those who are not vaccinated. So there are two different sets of guidelines, which I will explain. First, we're going to address the ones for the vaccinated population. If you have already been fully vaccinated, which means that you've received 2 doses of your vaccine, you are allowed to travel after you travel 2 weeks after your 2nd dose, or the Johnson & Johnson, which is basically under a different set of rules. When you arrive upon your destination, so let's say you are going to California from Rhode Island, upon your arrival, you need to make sure that the first 3 to 5 days before you travel, you need to do a self-monitorization to make sure that you are in good health and you do not notice any symptoms, such as a fever or a cough, or perhaps a runny nose, or perhaps you may have lost your sense of taste. If you notice any of these symptoms within the first 3 to 5 days, you need to go and get tested for COVID-19 at a local testing center. Okay, there'll be no charge. This testing will be free. If you're negative, that is good news. You can continue and proceed with your travels. If you're positive, unfortunately, you will have to self-quarantine for 10 days, which is in accordance with the CDC guidelines. Self-quarantining for 10 days. You will then have to call your physician, your doctor, or your hospital of choice to go get your test. However, you will continue to mask at all times because you cannot travel on airline travel or any form of public transportation without a mask. California or any other state that you travel to upon your arrival, you must adhere to their guidelines. The recommendation that we have is for you to mask at all times, especially in congested areas. You know, unless you're out in public and then there are very few people, then you don't have to wear a mask. Wear a mask. Now, for those who are not vaccinated, there are more stringent guidelines put into place, and they are as follows. Before you fly to your choice of destination of where you're going, you are required to take a COVID test. That is mandatory. That test must be taken 3 to 5 days before you travel. Okay, so let me give you an example. Suppose you're flying on December the 7th. So now you would have to test 3 to 5 days before your departure on the 7th. That means you would have to do a test between December 2nd, 3rd, or 4th. That is 3 to 5 days. You must have your results before the 7th before you fly, because you will need the results of your test before you can join the manifest or the roster to fly out. If you're positive, you will not be allowed to travel. And you'll have to self-quarantine for 10 days and then make arrangements to go to a doctor. So on the date of your departure and you arrive to your destination on December the 7th, you are required to self-quarantine for 7 days. Whether you are staying with your family or friends, or at a hotel, or a vacation house, or an Airbnb, that location is where you are to remain for 7 days for self-quarantining. If you begin to experience any symptoms, usually you will notice them between the first 3 to 5 days. If you do, then you would have to call to make an arrangement to be COVID tested. If you show that you are negative, then you can stay for the 7 days, complete your 7 days of quarantining, and then you would quarantine until the 14th. Beyond that, once your 7 days are completed, you are allowed to depart and go about your business on your vacation. Again, if you experience any symptoms, you are to schedule for the guidelines that are listed in CDC or whatever guidelines that are put in place at the state that you are visiting. However, you are required to mask at all times. It is our recommendation that we mask at all times to protect not only yourself, but to protect others around you. Okay, now you may say I'm negative, okay, but you could be asymptomatic, meaning that you've contracted COVID-19, but you experience no symptoms or anything like that, but yet you are capable of spreading that COVID virus to other people around you. And even though they are vaccinated, they can still potentially be stricken with illness. So we want to lower the chance of harming and causing harm to other people. Okay, so think of others when you take this into consideration about self-quarantining, okay, whether you're indoors or outdoors. Those are the guidelines for the vaccinated or non-vaccinated people. Okay, if you need further information to be clarified, you can go to the Rhode Island Department of Health's website, which is listed below. Or you can call their information line, which is also listed below. Their number is as follows. If you prefer, you can contact me, Mike Baer, at my office at the Rhode Island Commission for the Deaf and Hard of Hearing and call me. You can call me at my video phone number, which is listed below, or my voice line. Or if you prefer, you can send me an email at the following email address listed below. Lastly, I will show you a chart that will have all the check marks shown for those who are vaccinated and not vaccinated. Okay, so keep an eye and be alert as to the guidelines that are changing constantly within the states that you are traveling. Thank you.